for the talk show. Get in the car, let's go. The Commuter Talk Show. Come on, all y'all, let's go. Been waiting all day. Come on now, let's celebrate. Open the door, take a seat, it will be great. The Commuter Talk Show.
And welcome to another webisode of the Commuter Talk Show. I'm your host, Marc Wasserman, the Commuter. And today I have a very special guest. He is a doctor who specializes in geriatrics. He has been doing so for well over 30 years. He is world-renowned, travels across the country lecturing and speaking, co-founded a facility in Colorado, and he is my brother. So please welcome Dr. Michael Wasserman into the passenger seat. And we're here on our way on the 405 to the Los Angeles International Airport. And here's our guest, Dr. Michael Wasserman.
Hello.
Thanks for joining us. I've told everybody that you're my brother.
Well, I'm proud of you. Isn't that what I'm supposed to say? Do I get to tell people that I changed your diapers?
That we can let people know that. I don't have a problem with that. And now you're changing other adult diapers, isn't that right?
Fortunately, I don't get to do that.
So tell us, we know you're a geriatrician. I've let them know that. Tell us what that's about.
Well, I take care of old people, and we have a large practice in Denver. We do house calls. We go to nursing homes, assisted living. The population's getting older, and we need doctors who take care of older people.
Now, house calls, that's not something that's very common amongst doctors these days. Is that true?
That's true. We're pretty unusual in terms of doing that, but it's a lot of fun. Everyone enjoys it. There's nothing like going to someone's house and seeing them. They'll make you some coffee and cookies, and you really get to know people for who they are, rather than in the sort of the sterile setting of an office or the hospital or whatever.
So would you say that your patients look to you as a little bit more than just a doctor?
Yeah, our patients, we're almost like friends. And some of them, you know, I have one patient, she brings me cashews every few months, and she brought me some cognac for the holidays. Our practice has 20 doctors and 27 nurse practitioners and physician assistants. And we take care of over 10,000 senior citizens in Colorado.
That's great. And along with that, I know you travel a lot. You have speaking engagements and lectures.
I used to. I don't do as much travel anymore. I want to try to be home for my family.
Tell us about 2005 when you visited the White House.
I didn't get to the White House, but we went to the White House Conference on Aging in Washington, which was every decade the White House sponsors a conference to deal with aging issues around the country. So I was the lead delegate from Colorado to Washington, D.C., and we got a lot done, and we actually just formed a group called Silverprint Colorado in Colorado that's trying to keep the flame burning to deal with all the issues that are important to senior citizens.
Well, what are some of the issues?
Healthcare, finding enough doctors to take care of people with Medicare, transportation. As people get older, they have more trouble getting around. Social Security, which is going to go bankrupt. You name it. Just about everything affects seniors and affects all of us.
Because we're getting older every day.
We're getting older, and the cost to society is going up.
What is your basic philosophy towards living healthier as you're aging?
I believe in exercise, and I practice what I preach, unlike my brother.
And now wait a minute, I exercise every 2 or 3 years.
You know, it's fun because I'm 48, and I am faster than I've ever been in my life. Now, you can beat me in about a 30-yard dash, I imagine, but anything longer, I doubt.
Well, hold on, I don't know if I can make it 10 yards right now, okay? But wait, now that leads me into another aspect of your life, which is triathlon.
Yep.
You run, well, I guess you can't say you run, bike, and swim.
Run, bike, and swim, and in 2007 I did 3 half Ironman. And again, I compete. I'm every year I get faster, which I think is important, because just because you're getting older doesn't mean you have to slow down.
What kind of training regimen do you go through?
I train about 12 hours a week, and one day I'll bike, and one day I'll run, one day I'll swim, I'll do weights, do a little both on some days.
Now, do you do that just to get ready for a triathlon, or in your daily life?
I pretty much have worked that into my daily life, and I do it year-round, and I think it's good for one's health. And you know, you don't want to go to a doctor who tells you to lose weight while they're sitting there weighing 300 pounds, or tells you to stop smoking while they're smoking. And if your doctor's going to tell you to exercise, I think you should be able to say that I exercise too. Actually, I had patients who would say, but doctor, I don't have time. I got bingo on Monday. I got the grandkids on Tuesday, and you know, I don't have time to exercise. Tell them, look, I work full time, I'm busy, and I still fit in my exercise.
Well, that's very committed. Now, one other... What?
I should be committed.
Yeah.
Some people have said that too.
Well, I definitely think you should be committed somewhere. Now, what about having to deal with death? I would imagine that comes up a lot in your line of work.
It does. And I think the neat thing is knowing how to be realistic and talk to people when it's time to die. And I find that most of my patients are very open to that. They know that when their time comes, they don't want to have lots of things done to them, and they don't want to suffer. They don't want to be kept going for no reason. And I think that's I think most geriatricians are good at talking to people about what's important to them. And actually, since I'm on video here, if you watch doctor TV shows, on the doctor TV shows, you see someone on life support or in the ICU, and the doctor always will come in and say, what do you want us to do to your mom? And I never say that. I always say, what would your mom want? And that way, families don't have to feel guilty when they make those tough decisions.
And those are tough decisions. Now, what's your stance on euthanasia?
I think if more doctors really listened to people and did what they really wanted, we wouldn't have to have euthanasia.
And why is that?
Because we're pretty good at making sure people are comfortable and not suffering and not in pain. A lot of doctors are afraid to give an extra dose of a pain pill, and if that extra dose is needed for comfort, but it also helps the person stop breathing, then so be it.
And that's not euthanasia?
That's not euthanasia. To let someone suffer is wrong.
So
but we don't have to kill them. We can knock them out. We can sedate them, things like that. And
isn't that just semantics? If you're knocking them out and sedating them until
a fun interview. That's a tough one.
I gotta get to the core of what we're talking about. I mean, you're killing them or you're not. You're putting them under and then they're going to lapse into a coma. Isn't that the same thing?
Generally
Splitting
not.
hairs?
Generally not. Generally, you're making sure people are comfortable and you're letting nature take its course.
All right.
That's the other part is we don't really have the power over life and death. And some people die when they're ready and some people don't. And we can't control it as much as we think we could.
Absolutely. I absolutely believe in that 100%. Well, I thank you for letting me interview you.
I'd get out, but we're in the middle of the 405 freeway.
Let's take a look.
Oh my gosh.
Just nothing but traffic.
You know, I tell you, I don't miss this. When I moved to Colorado 14 years ago, and I came back 3 months later, I was on the freeway where I realized that I never wanted to come back to California again and live here, because I don't miss this.
Well, I certainly have to deal with it every day, and I'll never get away from it, but I can appreciate not having to deal with traffic like this. Now, before we go, I think we can see a little head peeking out the back there. Why don't you introduce us to your daughter?
This is my oldest daughter, Rachel, and she's a junior at University of Denver. She is a writer, and in fact, she'll be publishing her first novel in the next couple months.
All right. What's the name of the novel, Rachel?
The Fall of New Peking. It's kind of a political piece. It's about a young woman's struggle with her tyrannical ruling family and who she politically disagrees with, even though she still has strong feelings for, and so she joins the rebellion and kind of she has to fight through her feelings while she's fighting this war.
Wow, that sounds incredible, and we'll be sure to more information when it becomes available. We'll let you know where to get it. So again, thank you.
One more. I can't let you finish. I've got another daughter, Justine, who's going to have a CD out in the next few months. And if I don't tell someone that, she'll make me pay for it.
That's right. It's a talented family that we have here. So we'll get that CD out for Justine, and we'll get Rachel's novel out. Everybody will listen and read, and we look forward to Dr. Michael Wasserman helping everyone stay alive a little bit longer and a little more comfortable. Thanks for jumping in the passenger seat.
You're welcome. It was great to do this.
And we'll see you next time on the Commuter Talk Show. Commuter out.
It will be great, the Commuter Talk Show.